Let me ask you something, and be honest with yourself. Have you ever sat in the bathroom for 30, maybe even 60 minutes, feeling like you need to go, but nothing happens? You can feel it there, the pressure, the discomfort, but your body just won't respond. And then you give up, walk away frustrated, telling yourself, I'll try again later. But later comes and the same thing happens again and again. If this sounds familiar, this is not just constipation, and it's not something a simple home remedy will fix. My name is Dr. Louise, and today I'm going to explain what it really means when stool gets stuck in the rectum, why this is far more serious, especially after age 60, and exactly what you should do step by step. We'll be talking about real anatomy and real solutions. It may feel uncomfortable, but your health comes first. If this feels even slightly familiar to you, I want you to type yes in the comments right now. You're not alone in this, and it helps more people find this video who are struggling silently. What is actually happening inside your body? Let me paint a picture for you. Not a textbook picture, but a real-life one that I hope makes this immediately click. Imagine a long, winding river. For years, that river has flowed beautifully. The water moves steadily. Everything downstream gets what it needs. Now, imagine that over the course of a week, very gradually, very quietly, the water slows down. Maybe there was a dry spell. Maybe some debris began to pile up in a narrow section. The river does not stop overnight. It just slows and slows and slows until one day the debris has compacted so tightly at one particular bend that the water literally cannot flow through anymore. That is your colon. That is what is happening right now. The medical term for this is a fecal impaction, but let me tell you what that actually means in plain language, because I think the clinical term lets people underestimate just how serious this truly is. Your large intestine, your colon, is essentially a muscular tube. Its main job is to move waste material toward the exit while simultaneously absorbing water from that waste. Under normal, healthy circumstances, this is a beautiful, almost automatic process. But here is where aging changes the game significantly. As we get older, several things happen simultaneously. The muscular contractions that propel waste through the colon, those rhythmic squeezes called peristalsis, slow down. The nerve signals that coordinate those contractions become less efficient. Thirst sensation decreases, which means many older adults are chronically dehydrated without even knowing it. Medications for blood pressure, iron supplements, calcium channel blockers, and certain pain medications directly slow down bowel motility as a side effect. Put all of those factors together, and you have the perfect internal environment for stool to move through the colon too slowly. It sits in the lower segment too long, loses too much moisture, and transforms from something soft and manageable into something hard, dry, and essentially immovable. By the time it has been sitting for 5 to 7 days without passing completely, it has dehydrated into what can only be described as a dense, solid mass. And when that mass reaches your rectum and it simply cannot fit through, you have a fecal impaction. The pressure you feel is real, the exhaustion from straining is real, and the fear that something is seriously wrong is also completely justified. A fecal impaction is not harmless. The first issue is structural pressure. Your rectum is not designed to hold a cemented, dehydrated mass indefinitely. When it is chronically over-distended, the blood supply to the tissue lining the walls becomes compromised. In severe cases, this can lead to tissue injury that requires medical intervention. Now, here is something that genuinely surprises most people. Your rectum and your urinary bladder are neighbors. When your rectum is packed with a solid, rigid mass, it physically pushes against the bladder. What patients experience is a sudden and confusing difficulty urinating, a feeling of constantly needing to go, but only passing a few painful drops. I have had patients who were convinced they had a bladder infection when the real cause was a rectal impaction compressing the bladder from behind. There is one more symptom I must warn you about specifically, because it confuses people so profoundly that they actually end up making things dramatically worse. It is called overflow incontinence, and it looks exactly like diarrhea. Here is what happens. The solid mass blocks the main exit, but your intestines are still producing liquid waste higher up. That liquid seeps around the outside edges of the hard blockage, like water finding a crack in a dam, and leaks out unpredictably. People see this liquid and think they have diarrhea, so they take anti-diarrheal medication. This is one of the most dangerous mistakes you can make. Anti-diarrheal medications shut down the movement of your intestinal muscles. You will paralyze the very mechanism your body is using to try to work around the problem, and you will cement that impaction even more deeply into place. If you are experiencing what appears to be diarrhea alongside days of feeling like you cannot fully empty, please consider the possibility that it is overflow and do not medicate it without speaking to a doctor first. Fecal impaction disproportionately affects adults over 65. Reduced mobility is a major factor. When we move our bodies, we are mechanically stimulating the digestive system. When mobility decreases due to arthritis or surgery, that stimulation disappears. Dietary changes and decreased thirst also play a role. So, what should you do if you are in the middle of this situation right now? The very first instruction is, stop straining. I know it feels instinctive, but a solid impaction does not respond to pressure from above. Additional straining only increases the risk of hemorrhoids, anal fissures, or placing dangerous strain on the heart. Stop straining, breathe, and let's work through this. Step 1. Glycerin suppositories. Go to any pharmacy, no prescription is needed. For a hardened impaction, many practitioners recommend using 2 to 3 adult-strength suppositories simultaneously. Lie on your left side. This position works with your anatomy to direct the medication toward the mass. Use a water-based lubricant, insert them gently, and then, do not move. Stay on your side for 30 to 45 minutes. Glycerin needs time to draw moisture into the stool. Step 2. If nothing happens, walk slowly around your home for 15 minutes to stimulate movement. Then lie back down and repeat the process for another 45 minutes. Step 3. If that fails, try a warm water or saline retention enema. Follow the instructions carefully and hold the fluid as long as possible. Step 4. If all at-home attempts are unsuccessful, go to an urgent care or emergency room. This is a smart medical decision. The hospital has access to high-volume therapeutic enemas and imaging. In severe cases, a specialist will perform manual disimpaction. It is a safe, routine procedure, and the relief patients feel afterward is extraordinary. Once the impaction is cleared, your body needs to recover. For 48 hours, the tissue will be sensitive. A warm sitz bath can provide significant relief. Focus on soft, fiber-rich foods like oatmeal and cooked vegetables, and drink water consistently. Long-term prevention rests on 4 pillars. First, hydration. Aim for at least 6 to 8 glasses of water per day. Second, movement. A 20-minute daily walk is one of the most powerful things you can do for digestive health. Third, dietary consistency. Soluble fiber from oats and legumes adds necessary bulk. And fourth, scheduled bathroom time. The body's natural signal is strongest in the morning. Sit on the toilet every morning, even if you don't feel the urge. Use a footstool to elevate your feet, which puts your body in the optimal position for elimination. Do not rely on stimulant laxatives long-term. Daily use can lead to a cathartic colon, where your intestines forget how to move on their own. Instead, talk to your doctor about safer osmotic agents or stool softeners. I know this was a long conversation, but you deserve to understand what is happening inside your own body. Tell me in the comments about your health situation and your age. I will reply to every single comment. Take care of yourselves, drink your water, move your body, and I will see you in the next one.